Welcome to Supplements Demystified. In today's video we will be talking about magnesium. We will be going over the different forms it comes in, its physical and mental benefits, as well as how much and when to supplement. Magnesium is an essential nutrient for the whole body. It is not only the fourth most abundant mineral in our tissues, but it is required for more than 300 biochemical reactions that keep us alive. Due to poor soil quality and heavily processed foods, the modern-day diet contains much less magnesium than what is required for optimal health. According to studies done by the USDA, it's estimated that around 68% of Americans are magnesium deficient. The recommended dietary allowance for adults between the age of 19 to 51 is around 400 mg for men and 300 mg for women. During pregnancy, women require a little bit more at around 350 mg daily, and individuals who are clinically deficient might need much larger doses. There are many forms of magnesium, but the most bioavailable with the least amount of side effects are glycinate, malate, taurate, and lactate. We will discuss later what to take and when. Magnesium works through several pathways to build and preserve bone density. It optimizes vitamin D levels, raising them in deficient individuals and lowering them in those with high levels. It converts vitamin D into its active form to help with calcium absorption and bone building. It stimulates the release of the hormone calcitonin, which helps to preserve bone and draws calcium out of the blood and soft tissues and into the skeletal system. Research has found that magnesium also suppresses parathyroid hormone, which slows down bone turnover. A study published in the Journal of Biological Trace Element Research gave 20 postmenopausal women magnesium supplements for 30 days. The researchers found that blood markers responsible for bone building increased, and indicators used to measure bone turnover declined. The study suggests magnesium is useful in the treatment of osteoporosis and that the positive effects can be seen rather quickly. An analysis published in the British Medical Journal links subclinical magnesium deficiency with serious cardiovascular risks such as hypertension, arrhythmias, and arterial calcifications. Magnesium helps regulate electrical activity of the heart and allows blood vessels to dilate properly. The study evaluated dozens of clinical trials measuring magnesium levels in almost every population and determined that at least 12 to 20% of individuals were deficient. The numbers get significantly worse as we look at the elderly and those that have chronic health conditions where deficiency is diagnosed in at least 50 to 80% of people. A study published in the American Journal of Hypertension investigated the blood pressure lowering effects of magnesium. The study took 48 patients with mild hypertension and gave 24 of them 600 mg of magnesium daily for 12 weeks. The group that received the magnesium showed a small but significant decrease in blood pressure. Another study published in the journal MPDI Nutrients took 48 hypertensive patients, 19 men and 29 women, and gave them 300 mg magnesium daily for a month and tracked a variety of cardiac parameters. The patients showed significant improvement in systolic and diastolic pressures. Both measurements dropped by close to 10 points, and the researchers noted a significant decrease in systemic vascular resistance and left cardiac work. Magnesium as an electrolyte has many important regulatory roles in the muscles and the nervous system. In combination with calcium, it controls contraction and relaxation of muscles as well as optimal nerve signal transmission. Deficiency can result in frequent and involuntary muscle contractions in the hands and feet, muscle cramps, weakness, vertigo, and tremors. The research shows that while magnesium won't improve performance in healthy individuals with normal levels, it will still provide recovery benefits by aiding with protein synthesis and controlling inflammation. A study followed 18 professional male cyclists going through a 3-week cycling race which covered around 2,000 miles. The experimental group received 400 mg of magnesium daily with breakfast throughout the race, while the control followed the standard diet, hydration, and rest protocols. The researchers took blood samples from the athletes at multiple points throughout the event. The results showed that the magnesium group had a modest decrease in muscle damage markers and maintained better muscle integrity. Another study published in the European Journal of Applied Physiology investigated the effects of magnesium on glucose metabolism and inflammation in athletes. 9 male runners were supplemented with 500 mg of magnesium daily prior to a 6.2-mile downhill run. Magnesium supplementation reduced pro-inflammatory cytokines, enhanced recovery of blood glucose, and reduced muscle soreness, but did not improve performance. Overall, individuals that are deficient in magnesium are likely to restore physical performance by supplementing, but they won't experience supraphysiologic benefits. The anti-inflammatory and recovery benefits seem to be pretty universal. Magnesium plays an important role in glucose metabolism due to its support for insulin secretion and insulin sensitivity. Studies suggest there is a strong link between diets with higher amounts of magnesium and significantly lower risk of diabetes. A study published in the Journal of Diabetes Care analyzed the results of 3 U.S. cohort studies in order to find the link between magnesium intake and diabetes risk. The data compiled was of 17,000 cases of type 2 diabetes over the course of 28 years. Researchers found that those individuals with the highest magnesium intake had 15% lower risk of type 2 diabetes. They hypothesize that processed food with low amounts of magnesium is a large contributor to uncontrolled blood sugar. A study published in the European Journal of Clinical Nutrition did a systematic review and meta-analysis of trials on magnesium supplementation in people with compromised glucose metabolism. Data from 18 total studies was compiled, and researchers found that magnesium supplementation reduced fasting plasma glucose, significantly improved results from an oral glucose tolerance test, and improved insulin sensitivity in both diabetics and those at risk. While the mechanisms through which magnesium affects inflammation are largely unknown, there is a clear relationship between magnesium deficiency and inflammation in the body. A systematic review and meta-analysis published in the Archives of Medical Science looked at 96 randomized control trials to determine the effect of magnesium supplementation on C-reactive protein. The compiled data indicated that there were significant reductions in blood CRP concentrations following supplementation. A paper published in the Journal of Biomedicine outlines some of the pathways through which magnesium provides anti-inflammatory benefits. One such pathway is through its ability to maintain our body's levels of endogenous antioxidants. Researchers point out that magnesium is a cofactor for several antioxidant enzymes, and that without it over time, increased oxidative stress leads to low-grade chronic inflammation. A study in the British Journal of Cancer found that there is a link between magnesium deficiency and risk of pancreatic cancer. A group of over 65,000 men and women between the age of 50 to 76 had their dietary vitamin and mineral intake tracked for 8 years. The data showed that for every 100 milligrams of magnesium missing from daily food intake, there was an associated 24% increase in the incidence of pancreatic cancer. The researchers believe magnesium's positive effects on blood glucose provide the protective effect. A compilation of research surrounding magnesium leads scientists to believe that its deficiency is linked to mental health disorders such as fear, anxiety, depression, poor attention, and insomnia. While not every psychiatric disorder is linked to inflammation in the brain, research shows that it could play a role in symptoms that include depression, anxiety, irritability, anger, and fatigue. An animal study published in the Journal of Psychopharmacology explored the link between magnesium deficiency and the expression of inflammation-related genes in the brain. Researchers induced magnesium deficiency in mice and collected material from the hippocampus. Through RNA sequencing, they confirmed that the deficient mice had increased neuroinflammation. A study published in the Journal of Biological Trace Element Research assessed whether magnesium intake could modulate depressive symptoms. The participant group consisted of 402 postgraduate students studying in Malaysia with a median age of 33 years old. The results of the study demonstrated an inverse relationship between magnesium intake and depressive symptoms, which persisted even after adjustments for external factors. Researchers speculate that the lack of magnesium in the diet causes disruptions in the levels of several key enzymes, hormones, and neurotransmitters within the brain. This disruption in brain metabolic health leads to depressive symptoms. Now that we know how important magnesium is for our health, let's talk about what forms to take and how much. Most studies on magnesium use doses of 400 to 600 milligrams per day, with doses of 1 gram or higher to correct clinical deficiencies. Always start supplementing with a low dose of 200 to 400 milligrams so that your body and GI tract can adjust. For health and recovery benefits, you can supplement with 200 to 400 milligrams magnesium glycinate or sucrosomial magnesium daily. To increase sleep quality, take 200 to 400 milligrams of magnesium glycinate right before bed. Other acceptable options are magnesium malate, magnesium taurate, and magnesium lactate. For individuals prone to gastric distress, taking magnesium supplements with food can help prevent side effects like diarrhea, nausea, and vomiting. If you have any questions, leave them in the comments below, and remember to like and subscribe for more content. Thank you for watching, and see you next time.